Now the first speaker you heard is a member from the Society of Financial Service Professionals. The society has been doing financial counseling for bankrupts every Tuesday morning at the official assignee for about 7 years already. Now, over these 10 years or so, we've come across, when people come for financial counseling, that means they're in trouble, right? Everything cannot pay. Okay? Before they start talking, they will cry first. So we started this program because we kind of look at all the, of course we have gone through like thousands of cases. We try and figure out, what are some of the things that you need to know? What are some of the considerations and decisions to make so that you don't end up coming to ask for financial counseling, because by that time, it may be too late already. Okay? So today really we're going to talk about working backwards, what you need to know, what are the things you need to think about, so you don't end up being bankrupt or being sued for bankruptcy or be homeless or whatever. Okay? I'm going to start with healthcare. You heard the news recently, right? That MediShield Life will be implemented. That means all the Singaporeans will be covered. You see, right now, only 92.8% of Singaporeans are covered by MediShield. The other 7.2% are not covered. Why? Because amongst these 7.2%, a lot of people who are people with disabilities, people who are uninsurable, people who are very sick. I've got a lot more is people who are so poor that they cannot afford to pay the premium. So government has already announced that they will have universal coverage. Everybody will be covered. And since everybody will be covered, everybody has to pay more premiums. So that already announced. The only thing is when you have to start paying the increased premium, we don't know. But by the way, your premium just went up on 1st March this year. We have met a lot of people who come to us for financial counseling, and they are homeless because they sell their house to pay for their medical bills. You must have read, if you read the Wan Pao in the newspaper, you must have read stories of Singaporeans selling their house to become homeless because of medical bills. So I'm going to start right from the beginning and tell you what you need to know, what steps you need to take, so you don't end up in that situation. Okay, some of you are a bit like laughing, okay? It's not going to where the homeless shelter is. When you fall sick, okay, what do most people do? You see doctor first, right? Okay. And the doctor says, wow, this one is quite serious, no? Send you to the hospital, right? Okay. Then, of course, you can choose between a private hospital and a public hospital. Now, most people at that time will say, I think I better go to the public hospital, you'll start doing it cheaper, right? So you go to the public hospital, okay, then they also have a financial counseling section in all the hospitals now. They will ask you, what class or what do you want to go into? Okay, you have A, B1, B2, and C. Okay, how many of you want to go to A1? Don't have. One. Okay, why? Never mind. Okay, how many of you want to go to B1? How many of you want to go to B2? How many of you want to go to C? Now, a lot of people at that stage, they are a bit, because they will give you an estimate, okay, you have this problem, we think will take about. Once you are ready, you tell me again. Are you ready?
Not yet.
Okay. Right, they will give an estimate, okay, your this one operation will take about a week. So if it's A, it's 50,000, if B1 is 25,000, if B2 is 10, if C is only 2,000. So a lot of people will say, okay I think I take maybe C or B2, right? Okay, you have a problem, okay? You know why? If your referral letter comes from a private clinic, you're not eligible to enter C and B2 ward, no? So how? So instead of paying 2,000 or 10,000, you have to pay 25 or 80,000. No, okay? After you listen to us, you know what to do, right? So you say, okay, you leave the hospital, you go to the polyclinic and you queue up again, you get another referral letter, then go back to the same hospital. Okay, then you are eligible to enter class C and B2. How many of you are aware of this? Aware, you know, okay. How many of you don't know? laugh. Now the problem in Singapore is, if you enter into a non-subsidized ward, which is A or B1, okay, then at first they say it's 1 week problem, then the 1 week problem becomes 2 week, 3 week, 4 week, you say you cannot pay, right? Then what happens? It's a request for downgrading to a lower class ward. Okay? The last time they asked a question in Parliament, they asked the reply, what is the percentage successful for people who apply to downgrade from a higher class ward to a lower class ward? The answer was 1%. That means 99% fail in their downgrading request. Why? We don't know lah. After all the means testing, everything fail lah. Right? So a lot of people who come for financial counseling, in a way they say it's not their fault lah, it's ignorance, they don't know. Okay? So remember that one. Now even if you know, right, we come across people who know about this problem and still they end up in a non-subsidized ward. I'm going to explain to you why. You read the newspaper nowadays, right? Go to hospital, then want to be admitted, no bed, right? No bed, right? Okay. So I come about a lot of places. Let's say your daughter is with you in the hospital, she's the one who's admitted, okay? Then you wait for 1 hour, 2 hours, 3 hours, 4 hours, 4.5 hours already. You cannot take it already, no? Right? So the hospital tell you, okay, I have a non-subsidized ward available. Right? If you are willing to upgrade, can go straight away already. So what do most parents do? You are the son and the daughter, one for all of you. Your mother is in pain waiting to be admitted. What do all of you do? Okay lah, we go to the, non-subsidized ward. Okay? So I teach you something today, okay? Now this one my friends in the hospital tell me, it may change lah, because all this information can change one. They have a benchmark as to the maximum number of hours that we can make bed there. And we think the benchmark now is 5 hours. So what happens is, the moment you wait more than 5 hours, they have to do 2 things for you. Either upgrade you to a higher class ward, you still pay the lower one there. Like fly airline, but you upgrade to business class, still pay the same. Or they have to transfer you to another hospital with available subsidized ward. So now you know already, right? If you don't, like at some case I see, how long you wait? 4.5. Why did you wait another hour? Because you don't know. Okay? Now of course, the problem today is, when they first start the benchmark, the 5 hours is counted from the time you enter to register, Now I understand the 5 hours is counted from the time the doctor sees you. Remember the first case, the dengue case you died a few months ago, reported in the newspaper, that this big quarreling going on. The mother said he waited 5 hours. The hospital said he waited 2 hours. I see, I know the answer. Because one count from the time you go in, one count from the time the doctor sees. So whether you know, you don't know, still have to pay, right? So, like you say, you must have at least the Medishield CPF medical insurance. Because that one designed to cover you for C ward and B2. You must have one. Because if you don't have, then what happens? You know how much money is owed to the public hospital? About 100 million. And they just wrote off about 90 million over the last 3 years. So a lot of people cannot pay. Now what happens when you cannot pay your hospital? Anybody ever has experienced cannot pay hospital bill? Got friend or relative? You don't know, The debt collector will come look for you. The debt collector will come, or the letter will come, the legal letters will come. Okay? I've seen that the $40 also said debt collector because computerized one. Right? So a lot of people when they come to that stage, they panic, You know why they panic? A lot of people come for counseling, the first question they ask is, if I don't pay, then I don't get treatment, is it? So I want to explain to you, in the Singapore context, if you are in a public hospital, don't worry, can pay or cannot pay has nothing to do with the treatment, okay? They still have to treat you, right? Of course, when you go, they will ask you to pay, the debt collector will chasing you, but don't worry, right? As long as you are a public hospital in the subsidized ward, okay, you cannot pay, don't worry, right? The treatment will still go on, right? But here's the problem. What I mentioned, the treatment will still go on, right? But there's an issue today of when does the treatment start? Every week you read the newspaper, got people write to complain about what? One lady wrote, I saw a classic one. The father went, they said the father did some kind of test. You know how long you have to wait for the test? 12 months. So she said, by that test, maybe my father died already. Right? But what is happening today is, when they're in the public hospital, right, they will explain to you, okay, you know, your this illness, actually can be very serious, but actually normally not very serious lah. So the earliest appointment I can get you is 3 months later. Then they explain to you, that one is for subsidized patient. If you're willing to go to non-subsidized, next week I can do for you. Right? And you can choose me as a professor, you know. You don't have to just be attended by the doctor on duty that day. Okay? So the system today is such that hospitals are very, what word should I use? Stressed, you know. Right? Because every day they have to try to, I don't like to use the word convince, right? But they have to try to get enough people to opt for the non-subsidized so that they can collect enough money to cover the subsidized one. You see, it's not that the hospital staff are trying to make money from you or trying to be funny. You don't have a choice, right? Because at the end of the day, they must collect enough from the non-subsidized people to pay for the subsidized people. So this is something that is a decision made to make. I have no solution for this one like what I explained to you in the earlier problem. Because this one, if you choose to be non-subsidized, it can be long. Okay? Like this case I mentioned. Okay, so you go in, right? You have at least Medishield medical insurance. But like I say, in Singapore, depends whether you're lucky or not. Why? Now, a lot of people will tell you, you just have Medishield enough already. I tell you, in no uncertain words today, right? If you can afford it, it's not enough. You know why? Because there are certain treatment that are known as non-standard treatment. You know, certain type of illness, the operation, the drug, or the very expensive one. The highest I come across is $26,000 1 month. Some kind of cancer, right? They sell one house, about to sell the second one that they leave. Luckily the person died, he's not in the owners also. Okay, a non-standard treatment, a non-standard drug, right? That means either no subsidy or very little subsidy, very expensive one. So if you are unlucky, you get one of these, then having Medishield by itself is not enough because Medishield is designed for C and V2 standard treatment and drugs only. So like Leong explained to you, right, then you have to maybe opt for one of the private insurance plans. Basically, private insurance got 3 plans. Okay? B1 plan. B1 plan means designed when you go to B1 public hospital. Okay? Then public hospital as charge plan. That means whatever the public hospital charge you, they will cover. Then got private hospital as charge. Of course, the private hospital costs the most. The public hospital as charge is the next one. Then the cheapest one is the B1. So if you have a lot of money, you're very safe. And sometimes as you grow older, you say, wow, I see the premium going up. As I grow older, I have to top up with cash. Let me say this to you. If you can afford it today, better take the better plan because you never know. When you are old, anyway, next week I can get my senior citizen pass away. I sent you my application yesterday. So if you are very old and you find you cannot afford the premium, don't worry. Guaranteed downgrade to Medishield. Because all the private insurance companies, when they collect the premium from you, they're actually collecting the premium for the CPF board under Medishield as well. So the claim go to Medishield to process first, then the private insurance. Okay? The difference between dying in a hospital and dying at home. If a person dies in a hospital, both private and public, if you owe the hospital money, okay, and you don't have money to pay, right? But you have a lot of medisave, right? The hospital can take your medisave if you die in the hospital. If you die outside the hospital, then you owe the hospital money and you don't have money to pay, right? They cannot take your medisave to pay. Let me explain. Medisave has withdrawal limits, has eligibility limits. So normally, if a person dies and he owes money, that means whatever medisave withdrawal or eligibility limit already exhausted. So this money is, according to medisave rules, cannot be used to pay for the medical treatment. So give an example, person has 40,000 in the medisave account, right? Then he died in the hospital, owe the hospital 40,000. So hospital will ask the family to pay, right? But let's say this person who died has no money already, nothing in the bank, okay, no assets. So if he died in the hospital will take the 40,000 from medisave now. But if he died outside the hospital cannot take the medisave. Why? Because medisave, like CPF, is protected from creditors, and the hospital is like any other creditor. So the moral of the story is, if you're a very poor person or family, and you have medisave but no other assets, right? Try not to die in the hospital. I have one case, about 40,000, very poor family. So if the person had just said, I want to go home to die, at least the family will have 40,000 from CPF, instead of nothing. Okay, so this one, important information to know.
No money, to be diver at the good reservoir.
How? Because you cannot pay in Singapore. If you read the Ministry of Health website, it says Singaporeans who are unable to pay their medical bills can apply for Medifund. But there's no information to explain what's the criteria whether to give to you or not. Of course, you go to the hospital to ask, they also will tell you. But because we have many friends in the hospital, so we know, so I'm going to tell you, okay? In order to apply for Medifund, you cannot pay a medical bill. Firstly, it can only be applied to class C and B2. So if you go to B1 or A class, Medifund does not apply. Okay? For B2, even you get approved for Medifund, normally the approval is not 100%, maybe around 50%. Okay? And in order to be successful at Medifund, right, normally all family members' medisave must be wiped out. All family members cannot have more than a certain amount in their bank account. I think it's 4,000 or something. Okay. And anyone living in private property also will not qualify for Medifund. So strictly speaking, do not qualify for Medifund. All the family members' medisave must have been wiped out. Okay. And the person cannot be, the family cannot be staying in a private property. And of course, if you have more than 4,000 in the bank, then you apply for. Chances are be successful for Medifund. They have enhanced some of the schemes to help you. The CHAS, Community Health Assist Scheme, you saw earlier an orange card and the blue card. They have been enhanced. The per capita income has been increased from 1,005 to 1,008 or 1,009. So now, straight away, if you are 40 years old and above and you are Singaporean, you can go and get this card already, as long as the per capita income is not more than 1,008 or 1,009. Okay? Now, from 1st January next year, no need to be 40 years old, any age, born also can go and take already. Okay? Now, this card is very useful because when you go to the 500 plus participating private clinics, provided you meet the conditions, the clinic actually gets a subsidy from the government. But what a lot of people don't realize is that there's a world of difference between the orange card and the blue card. The blue one is for per capita income 900 and below. That one, no matter what clinic you go, dental, all have subsidy. But if your per capita is over $900 a month, then you don't get the blue one, you get the orange one. Orange one, a lot of people actually are misusing it. They think that when they go to see a private clinic participating, they get a subsidy. Actually, don't have. Orange one, no subsidy for visit to the clinic for dental. Only subsidy for chronic illness treatment. So people are going to the private clinic, giving the cards, thinking that they are paying less. But you just ask the person next to you, who happen to have the same ailment, you will discover that actually you are paying the same thing. So this one, most people don't know. Now you know that. Okay. Now Singaporeans has been liberalized. You can use your MediSave to pay for medical hospitalization in some hospital in Malaysia. Okay. But what you need to know is, you can use your MediSave to be hospitalized in the approved hospital in Malaysia, but all the CPF approved medical insurance scheme do not cover hospitalization outside of Singapore. So don't be like some people come for vaccine counseling. They say, oh, I go to Malaysia cheaper, up price, so I go. Then I use my MediSave, I'm very happy. Then when I pay my insurance, I cannot claim. No, I go to this place. Right? So you understand, right? If you have medical insurance, CPF approved can claim. Please don't go to Malaysia. Unless the amount is so big that if you claim here, so you die, you must go there and pay less. Right? So these are some of things that you need to know. But let me just summarize what Wendy is trying to tell you on healthcare financing. Our government actually doesn't spend a single cent on the healthcare because from a cash flow perspective, Singaporeans contribute about $7 billion a year to MediSave. Government spending on healthcare is only about 4.9 billion. MediSave used to pay for direct medical expenses about 700 million. MediSave used to pay for Medishield premium about 400 million. You add all this together, it's still less than 7 billion. So every year 7 billion come out here, less than 7 billion go out. So actually government doesn't spend a single cent on healthcare. And as long as this continues, I hope you realize that you have to think about all the, I would call them loopholes, all the things you need to know to navigate the current healthcare system.